Welcome to Doc Talk Live, take two. We had some glitches the first time around. I'm with Dr. Devan Szczepanski. Dr. Devan is a family practice doctor, and we started with the art of medicine, and from there I want to talk about wellness and nutritional genetics and neuropsychology. But tell us a little bit about what the art of medicine means to you.
Okay. So recently, where I kind of came up with that as part of my big vision and mission for what I want to do here with the practice and really with medicine that we do with family medicine in general, is the idea. I realized that the old school idea of the art of medicine truly encompassed what we had created over here at the clinic that really has grown organically. And I can very humbly say, not necessarily because of any one idea of mine. It really had to do with more of the patients and wanting every patient where they are and know that there are 5 right ways to treat anything. And truly, in my opinion, the art of medicine encompasses how we do medicine here and how we feel like we need to build our patients, with the idea that, there's always been this kind of dichotomy in the medical field traditionally with, is medicine a science or is medicine an art? Having a background in neuropsychology, I appreciate that it's both. And to say it's one or the other is to undermine the complexity of the human body and really the patient-doctor relationship, which is probably the most special thing that we have. It's a gift for sure. And so by
Devan cut off again. So we've got to be having internet issues. I assume we're live. If there's any questions out there, please feel free. I see my mom is actually watching. Hey, Mom. I don't think you know how to link into the show, but Mom, if you feel like asking a question, if anybody has taught me the art of medicine, it'd be my mom. My mom is interested in all things alternative. I hope you don't mind me talking about you, Mom. But the art of medicine to me would be to try to look at things in a holistic fashion. Hey, Devan, you're back.
Okay.
So,
I want to go somewhere different in the, let me go stand by a window.
Okay. Now I get to see your office. Your office is so much prettier than my room that I broadcast in, where I have boxes and boxes on boxes and stuff like that. So my mom is watching, Devan, and I was just telling our listeners that if anybody has taught me the art of medicine, it's my mother, because my mother is interested in anything alternative and is very open-minded to alternative treatments, but doesn't sort of bury her head in the sand and not consider traditional Western techniques.
Right.
So you're into nutritional medicine. Tell us a little bit about that.
So really what happened is I was an employed physician for a couple of years and decided to go out in a private practice. And as I did that, I decided to do some extra training in nutritional medicine, because to me, what I was lacking from traditional medical school training was nutrition. I don't think I had a single class in nutrition, ironically. And that's what my patients wanted to know about. And so I did extra training in that. And by incorporating nutrition into everything we speak about, even with regard to giving pharmaceuticals, because we know a lot of those cause secondary nutritional deficiencies. So as long as you can stay 1 foot in front of those things, using nutrition as first line medicine, I really feel like that's the future of where we're going, knowing the limitations of the world of pharmaceuticals, for better or worse.
So we all know the saying, you are what we eat.
Yes.
What do you tell people to eat? Son of a gun, we lost her again. So I'll just mention some things that I find sort of interesting. I like coffee. I think coffee is an excellent thing to drink. I think the caffeine helps with nutrition. I think coffee is a good substance. I was just sort of riffing here, Dawn, and saying things that I think are sort of maybe nutritionally important. I don't like to juice my foods. I personally don't think you should drink your calories. I much prefer that people eat their calories, eat their nutrition. I do think that avoiding breads and sugars is also good. Couple comments. Ed wants to know what we're talking about. Ed, feel free to ask any questions, but right now we're talking with Dr. Devan. Help me with your last name again. Szczepanski. She's in Louisiana. We're talking about nutrition right now. Christy says go outside. That you might have a stronger connection out there. And then I just mentioned coffee, and I mentioned don't juice your foods. What are your thoughts? And stay away from sugar. Yeah, we can hear you. You're not moving anymore. So go ahead. Just stay still or something. Oh, Christy, I'm so frustrated. So Frank, I'm definitely going to get to your question. Okay. Well, yes, you're back. I'm bringing you on. You're back. All right.
Okay. So I like to do with my patients nutritional genetics. So I would tell you that with regard to caffeine, that's a good one. So there's actually genetic variations. Some people metabolize caffeine really quickly. It's not really harmful for you from a metabolizing it and staying around and stuff like that. Other people do not. And so you wouldn't necessarily want to drink a pre-workout with a ton of caffeine and then go exercise. So with regard to juicing, I might tell somebody, hey, if you have horrible liver detoxification and you have bad breakdown of things based on your genetic variations, we'd want you to do maybe a juice cleanse one time as a reset and then move forward with foods. So we do use those as therapies, but not day in and day out dietary strategies. Does that make sense?
No, I don't mean to say that, but I'm multitasking. I hear that the audio may have been a problem. So people that are out there, please let me know if the audio is fixed. Frank wants to know, and I'm going to come back to juicing with you.
Okay.
You stay still because right now I've got you, and I don't want to lose you. It says, how important is nutrition in immunotherapy and chemotherapy? Are cancers nutrient specific?
I would say it's the most important thing. I mean, while your body is trying to fight all of those things, I would argue that nutrition is the first and most important thing. And that's what I think is lacking in the traditional medicine world, is that it's not taught as the most first important thing.
What about fasting to, is it my audio that's bad? What about fasting as far as cancer?
Oh, as far as intermittent fasting with
I lost her. I don't think it's my internet. I really don't. And there's so many questions I have because is fasting, is that considered nutrition or lack thereof? And I know it, for instance, at UAB, they study fasting for certain cancers. What else out there? We have comments. I'm happy to talk about anything, not that I know the answers to these questions. I appreciate you guys hanging with me. Y'all gonna have to try another day. It looks that way, doesn't it? Get her back sometimes. This is great. I'm gonna let her take over the show. I'm gonna have her do it with Christy. It's her internet. Well, that's good to know. Yes, it's not working. Sorry, it's her end. All right. Well, I guess I've just put a teaser out there for y'all. I will get Dr. Devan back another time with better internet. We're gonna pick up on this concept of nutrition. Seems to me that things are a little bit all over the map. You know, do you feed a tumor or do you not feed a tumor? Let's see. Are different cancers nutrient specific? Does bone cancer like protein? Does pancreatic cancer like carbohydrates? Exactly. That and I don't even know if Dawn will know the answer to those questions. It seems like maybe an oncologist who does nutrition would be good. But I will get Dawn back, and we'll do this another day. Thanks for watching, all. It's nice to see my mom out there. And Mom, I got your comment about salt. We'll just talk to y'all later. Bye.